This hearing and for our witnesses for all being here today. I do share the deep concern that have been expressed by many of the members here, as well as some of the folks that have testified here this morning about how the Affordable Health Care Act or the taxes that are in the bill in the new law have actually contributed to the rising costs of health care and are putting now a heavy burden on some of our best job creators, which we've just heard. As co-chair of the Medical Technology Caucus and as the chief author of the bill to repeal the device tax, I have a particular interest in how this tax, this really destructive tax, has been harmful not only from the American jobs, but also innovation and also to patient care. Now, already we've seen thousands of layoffs in this industry. I mean, that's pure and simple, thousands of layoffs, and it's a very dynamic, very vital industry. It's in Minnesota, it's around the country. The President has repeatedly stated his objective to increase domestic manufacturing, American manufacturing, and I think the irony here is that this is a policy that is actually being very harmful to achieving this goal. As our witnesses have already pointed out, it's having the opposite effect, primarily because this is a tax that applies to sales, not to profits. And it's going to raise the average tax bill by some companies by almost a third. And other countries are absolutely incentivizing these companies to make these products overseas while we're taxing and regulating, unfortunately, our best companies out of existence. And so this American success story, I think, needs to be protected. We can't take that leadership for granted. I want to ask this question, though, Mr. Moore and Mr. Heumann. I'm so glad you're here to testify about the very real effects that the tax is having on your employees and on your company and on on the quality of health care. But I'm wondering whether there are other hidden costs that are there as a part of this device tax if we dive a little deeper beyond the tax itself. For instance, I know that due to the new tax, medical technology companies have to keep track now of which products are sold in the United States versus which are sold overseas, which products are, quote, further manufactured, which are subject to the retail exemption, and on top of that, the tax is now paid every 2 weeks. Every 2 weeks, this excise tax. And I know many companies have hired full-time staff just to handle the device tax compliance. And I've spoken to some larger companies that sell thousands of unique products. Small companies have difficulty complying with the new rules. One company said they have 129,000 products that needed to be individually analyzed, which cost the company $10 million on the compliance side, including two full-time new tax employees, 4 to 6 dedicated brand new consultants on site for a year, and 2 new IT people as well. So that's not in the research and development side. This is in the compliance side. I don't think those are the types of jobs we should be creating. And so, Mr. Heumann and Mr. Moore, in addition to the $30 billion in the new tax that you're going to have to deal with the next few years, and the job loss and the innovation struggle, how is it now, how easy is it for your companies now to calculate and pay the tax?
Yeah, without a doubt, the tax provides a complexity that hasn't been there before. OsteoMed's whole mission in life is to improve patient outcomes. That's what we come to work every day to be able to do. And again, anything that we have to spend non-value-added time and resources on to administrate a tax, to figure out a tax, to pay a tax, is one less dollar that we have to, again, continue to innovate and come up with great new products to help people reduce health care costs and ultimately help patients.
Mr. Moore, are there other costs?
Well, I've seen estimates across the industry that reach into the hundreds of millions of dollars, which sounds like a lot of money. However, what we know is this 2.3% revenue tax is going to cost our industry $29 billion. So hundreds of millions versus the $29 billion. The bigger issue is still the device tax, and I think Republican, Democrat, there's agreement among many, bipartisan support that this device tax is bad policy and that it needs to be reversed. So the implementation at this point is the least of my concerns. The bigger issue is we're losing jobs, we're losing the American manufacturing and the leadership that we have. It's like deja vu all over again, back to my childhood as the son of a steel worker. One of the most difficult decisions I've had to make is to begin setting up manufacturing for the first time in our 25-year history outside the United States. And unfortunately, at this point, we've broken ground. I hope to limit those number of jobs and get back to creating more jobs in America.
Thank you, Mr. Chairman.
I thank the gentleman. I want to